Wisdom teeth. Well, people have a lot of confusion about the wisdom teeth, and my patients ask me this question all the time that can you show me where my wisdom tooth is? Do I need it? Is it helping me in any way? Well, a simple answer to this question is we do not need the wisdom teeth. Our ancestors needed the wisdom teeth, and that's why we have this extra set of molars called as wisdom teeth. First of all, it has nothing to do with the wisdom. It's just because they come late in life than our normal teeth, because they start to come through from the age of 17 to 25 when somebody's almost fully grown up. So that's why they're called as wisdom teeth, because they erupt later in life. But our ancestors used to rely a lot on raw fruits and vegetables. They used to eat meat which was very hard to chew because that wasn't a cooked meat. So hence they required more power and more chewing platform for eating their food. And that is why nature probably provided us with these extra set of molars. But the modern evolution is happening. Our jaw sizes are getting smaller because we are not eating the kind of food our ancestors used to eat. We are also eating more softer diet, having our full cooked meals. So for all these reasons, we don't really need those extra wisdom teeth because our jaws are small now and they cannot accommodate these extra set of molars. So answer will be no. In the modern generation, people now do not need wisdom teeth.
What are the common problems faced by wisdom teeth?
Well, wisdom teeth can be really tricky to handle, and there could be a lot of problems that we can come across when there is a time for the wisdom teeth eruption. First common problem is not having enough room for the wisdom teeth to come through because of the size of the jaws getting smaller. The wisdom teeth do get stuck in the bone. Sometimes they are fully impacted, they were completely seated underneath the bony structure. That means there is no space for them to erupt. We call them as impacted wisdom teeth. They can be partially erupted or called as partially impacted. That means they are partially out of the mouth and partially within the bony structure. They can be horizontally impacted or vertically impacted or get stuck against your last molar. This category of problem, which is a partially erupted or partially impacted wisdom teeth, is the most crucial one because that leads to a lot of accumulation of plaque and tartar, food impaction, your inability to clean that area properly, and hence leading to various other problems that we face with the wisdom teeth. Third is sometimes we see that the wisdom teeth have started to develop some cystic changes if they are seated in the bony structure. So it's always good to monitor the wisdom teeth and make sure that they are properly located by your dentist, and a thorough monitoring is done to make sure that we don't get a lot of problems in future from our wisdom teeth.
What are the symptoms of troubles with wisdom teeth?
The most of the trouble of the wisdom teeth come from your lower wisdom teeth because as we see the size of the lower jaw is much smaller compared to the top jaw, and most of the problems that we get from the wisdom teeth are from not having enough room to come through because of the size of the jaw. So if you get any severe pain, acute pain right at the back of the jaw, mostly in the lower or even in the top, then it could be the pain coming from the wisdom tooth eruption. Mostly the pain that comes from the wisdom teeth eruption or from the wisdom teeth itself are not from the teeth. They are coming from the gum because the wisdom tooth tries to come through. It creates a flap of gum over the surface of the wisdom tooth and it keeps on getting infected. In dental terminology, we call it as a pericoronitis. That means infection of the surrounding area of the wisdom tooth. And for that, sometimes the patients need to see their dentist or need to get some course of antibiotics or even extraction. So wisdom teeth problems can be in the form of pain, swelling, inability to eat your food, inability to open your jaw properly, swelling underneath the jaw structure. Sometimes you have problem with TMJ. Sometimes you feel unwell as such. So if you're facing all these problems, it could be coming from the wisdom tooth.
What are the immediate treatments for wisdom teeth trouble?
Well, mostly if you get in trouble from the wisdom teeth, the regular monitoring is very important. It's very important for your dentist and for yourself to know that where exactly your wisdom teeth are if you have some, because sometimes people don't even have wisdom teeth. So if they are parallel to the rest of your teeth and if they are fully visible, it's just make sure that you're able to keep it clean and your dentist is monitoring the position of the wisdom teeth. But if your wisdom teeth are impacted or if they are partially impacted or if they are leading to the crowding in your teeth because of their position, sometimes you have to have a planned extraction for the wisdom teeth because wisdom teeth can create a lot of future problems for our overall dentition. Can you pause it?
So what are the immediate treatments for wisdom teeth trouble?
Well, wisdom teeth troubles are most of the time immediate, and that is why the regular monitoring of the wisdom teeth is very important to make sure that we know where we stand in terms of the location of the wisdom teeth. If you get any infection from the wisdom teeth, mostly you get it in the form of severe pain. So it's very important for you to go and see a dentist because this is an emergency. However, if you're in the middle of nowhere and if you feel that you do not have access to the dentist, it's very important to keep that area as clean as possible. Try and get yourself an antiseptic mouthwash if you can and hold that against that area for at least 30 to 40 seconds and try and do that 3 to 4 times in a day until you get to see a dentist. When your dentist sees you, mostly with the patients with wisdom tooth trouble, they're not able to open their mouth properly. So mostly we cannot do any treatment in the patient's mouth when they are having this bout of infection. So mostly you're prescribed a course of antibiotics for 7 days to ensure that the infection of gum in that region is properly soaked before we can review and see what is the condition of the wisdom teeth. In many situations, the dentist might remove the flap of the gum, which is covering your wisdom tooth or which is holding the wisdom tooth from coming properly in your mouth. So if your wisdom tooth is fully parallel and vertical, the removal of the flap of the gum will really help in the eruption of the wisdom tooth, and that might resolve the problem. In many cases, if your wisdom tooth is impacted and is seated within the bony structure, and it's causing decay and problem to the other teeth in that region, your dentist will plan an extraction. So sometimes the general dentist can do it for you. Sometimes you need a referral to an oral surgeon who will visualize first that how deep is your wisdom tooth, how is the proximity of the wisdom tooth to the nerves underneath. So all this monitoring and planning will happen for the removal. So it's very important for you to know where you stand in terms of what are the potential problems or risks associated with the removal of the wisdom teeth versus keeping your wisdom teeth. So the right planning will be required in this case.
Should everyone remove the wisdom teeth?
Well, when it comes to the wisdom teeth, mostly people go for extraction of the wisdom teeth if there is an issue. However, if your wisdom tooth is totally fine, your jaws have space to accommodate your wisdom teeth, they are parallel with the rest of the teeth, they are in a proper bite with the rest of your teeth, you don't have to go for the removal of the wisdom teeth. Just keep it clean like the rest of the teeth, because to have access with your normal brush to go right at the back of the jaw sometimes can be difficult. So if you're finding it hard to clean, of course it's important for you to discuss this with your dentist and plan a removal if needed to. But if it's impacted, if it's causing problems to your rest of the teeth in terms of crowding, in terms of decay, if it's showing any cystic changes, because sometimes the impacted wisdom teeth can show some cystic changes which can also interrupt with the bone formation or can also cause problems to the nerves. In those cases, you should plan an extraction. So I always advise my patients that regular monitoring and taking x-rays by the dentist every 12 to 18 months become very important, because we need to know what is the progression of the wisdom tooth in case if it's impacted, if it's stuck behind your other teeth. So yeah, you don't really have to get your wisdom teeth extracted, but if you see there could be a potential problem, planning an extraction and being proactive about the extraction would be more in your favor.
Is removal of the wisdom teeth straightforward, or is it different to normal extractions?
Well, it depends. When it comes down to the extraction of the wisdom teeth, if it's parallel and it's visible like the rest of your teeth, or normal pulling out of the teeth by a general dentist, it's an absolutely straightforward procedure. But mostly that's not the case with the wisdom teeth. And if they're giving you trouble, they are somewhere seated deep down into your bony structure. So a surgical extraction is mostly planned for the wisdom tooth extraction by the oral surgeon. So the first appointment, they will assess your situation. Second appointment, they might discuss the options with you. They take your x-rays, they show you how far deep your wisdom teeth are. And in many cases, when they do the surgical extraction, you're given the option whether it's done under LA is